And here are the latest COVID numbers in Ohio. The state reported more than 20,000 new cases in the past 24 hours. That is 6,000 more than the 21-day average. Also, there were 708 new hospitalizations, more than double the average. We wanted to know how many patients are admitted to the hospital because of COVID and how many sought other care and found out they were positive after they were admitted. Marissa Science went looking and has this report.
Hospitals are overwhelmed. We hear it.
We have not seen any decline in hospitalizations, and they continue to inch up each day.
We see it. Today alone, the Department of Health is reporting over 700 new hospitalizations.
How many people are you seeing come in because of COVID, and how many people are you seeing come in for other reasons but happen to have COVID?
I can't really think of a single patient who was in for a random COVID-related issue and then who randomly tests positive for COVID.
Meaning, according to Joseph Khabbaza, a clinical care doctor at the Cleveland Clinic, the numbers are so high because the patients are so sick with COVID-19.
Typically because they have such a bad case of COVID that's the sole reason they're coming to the hospital. Is that what you're saying?
We had just over, low 20s ICU patients, and at most 2 of them were non-COVID.
It's similar for kids that are hospitalized.
It's both. Like, we're seeing an increase in both kids who are admitted because of COVID and kids who are simply admitted with COVID, but they're admitted for some other reason.
Khabbaza says everyone admitted to the hospital, no matter the reason, gets tested for COVID-19.
It's important to know also, what kind of a room to put these patients in.
And then if you're being treated for non-COVID issues and have a minor COVID case, you're released once your care needs are met.
So if you come in with a fractured hip, and we do see that pretty commonly, and then happen to test positive for COVID, but you end up getting your hip replacement and you're ready to leave, you don't stay in the hospital just because you tested positive for COVID. Extra days in the hospital don't come without risk. The sooner you get out of the hospital is always the better.
Marissa Science, 3 News.